I'd love to throw it over to our assistant producer, Rachel Ward, for a question that we have today from one of our viewers.
Yes, Gary. Emily from Johns Creek sent us this question about her ongoing injuries after an accident. I was injured after getting hit from behind by a driver who simply wasn't paying attention. I seemed fine even after my emergency room visit, but a couple of days later my back has started to really hurt. I was wondering what test I should ask to get a better diagnosis for what's going on with me. And that's Emily from Johns Creek.
Yeah, Rachel, we see that a lot. People assume that they're going to be okay after the wreck, but then they start hurting a couple of days later.
Yeah, what's really important about this question that Emily sent us was the fact that she did go to the emergency room right away, and that is critical to understanding what's wrong with you after an accident.
It really is. Rachel, thank you. And Emily, thank you for the question. I'm so sorry to hear about your wreck. We've helped many people that are from the Johns Creek area over the years, and I certainly appreciate you reaching out to us. And I do look forward to speaking with you about your wreck in more detail and offering you some advice. Now, let me start off with this little disclaimer. I am not a doctor and I don't play one on TV, but over the years we have seen so many different types of injuries, met with so many doctors, and have learned from experience a lot about the human body and the steps that doctors take to accurately diagnose and treat an injury. And there are 4 main diagnostic tests that doctors use to determine the extent of car wreck victims' injuries: X-rays, ultrasounds, CT scans, and MRIs. Now, X-rays are used to detect fractures and breaks, problems with teeth, thinning and weakening of the bones, perhaps a bone infection, an abnormal curvature of the spine, bone tumors. X-rays are a type of radiation. They're similar sources of energy to light. And X-rays have a higher frequency and pass through the human body. Energy particles called photons are absorbed at different rates as X-rays pass through the body, and this pattern shows up on the X-ray images. Dense materials such as bone show up as clear white areas on an X-ray image. The softer parts such as your heart and lungs show up as darker areas. Now, ultrasounds, these are procedures that use high frequency sound waves to create an image of part of the inside of the body. Ultrasounds are used to detect heart problems, help guide a surgeon performing some types of biopsies, examine other parts of the body such as the liver, kidneys, and abdomen. Most ultrasound scans don't take long to perform, typically between 15 and 45 minutes. And your ultrasound generally will take place in a radiology department of a hospital and can be performed at a doctor's office or by a sonographer. Now, there are 3 types of ultrasounds: external, internal, and endoscopic. External is used for examining your heart, liver, kidneys, as well as other organs or tissues that can be assessed through the skin, such as muscles and joints. Internal is used for examining internal organs. Internal examinations may cause some discomfort, but usually do not cause pain. And endoscopic, this is when it's inserted into your body orally, and it's used for examining areas such as your stomach, and usually will be given a mild sedative to help keep you calm and local anesthetic spray to numb your throat. Now, CT, or computerized tomography scans. These are often used to help identify conditions that were not suspected. And unlike other imaging techniques, such as X-rays, CT scans can provide detailed images of many types of tissues, including lung tissue, soft tissue, blood vessels, and bone. And types of CT scans. These are head scans. These can be used to check for suspected bleeding or swelling of the arteries. Abdominal scans. These can be used to detect tumors and diagnose conditions that cause internal organs such as the liver, the kidneys, the pancreas, the intestines, or lungs to become enlarged or inflamed. Vascular scans. These can be used to assess conditions that affect the blood flow to different parts of the body. And bone scans. These can be used to assess bone injuries and disease, particularly in the spine. Now, CT scans are often used after serious car accidents to look for internal injuries, such as tears in the spleen, the kidneys, or the liver. MRI, or magnetic resonance imaging. This is a type of scan that uses strong magnetic fields and radio waves to produce detailed images of the inside of the body. An MRI scanner is a large tube that contains powerful magnets. You lay inside the tube during the scan, and an MRI scan can be used to examine almost any part of the body: brain and spinal cord, bones and joints, breast, heart and blood vessels, internal organs. MRI scans do not involve exposing the body to X-ray radiation. So I know that is a lot of information out there regarding medical diagnostic tests. The big takeaway from this should be the following: if you're hurting, Please tell your doctor where you hurt. Describe the pain as best you can. This is not a time to be a tough guy or tough gal. The more information you provide to the doctor, the more likely they can determine the best test and or treatment for your injuries. So listen, if you or a loved one has sustained injuries, don't delay in seeking medical help and don't delay in seeking expert legal help. You owe it to yourself and to your family, to your loved ones, to get the help you need by calling a lawyer to discuss the facts of your claim. We'd be more than happy to talk to you. The phone number is 770-934-8000. The call is free. It's completely confidential. There is no obligation. 770-934-8000. And we will be back.